Many seniors struggle with unstable blood sugar levels, especially during the night. That sudden 2 a.m. wake-up, it's often linked to a drop or spike in glucose levels. But what if a simple kitchen ingredient could help stabilize that? Enter the humble onion. Onions contain a rare, naturally occurring compound called quercetin, a powerful antioxidant that helps increase insulin sensitivity. This means your body can process glucose more efficiently without overwhelming your pancreas. In seniors, where insulin resistance is more common, this is crucial. Moreover, onions also have allyl propyl disulfide, a sulfur compound that mimics insulin and helps regulate blood sugar levels. Research has shown that people who include onions regularly in their diets experience improved fasting glucose levels. Eating even half a raw or lightly cooked onion before bed may help reduce the blood sugar spikes that disturb your sleep. It doesn't mean skipping medication, but it can be a natural dietary support. Now, does this mean everyone should rush to eat an onion before bed? Not quite. But if you're a senior concerned with blood sugar, especially if you've had restless nights, introducing onion into your evening meal may be a small yet impactful step. But here's what matters most. Raw onions offer stronger effects than overly cooked ones. However, for sensitive stomachs, lightly sautéed onions in olive oil are a gentler but still effective option. Remember, natural doesn't mean it's safe for everyone. We'll cover potential warnings later in this video. Always consult your doctor before making dietary changes or adding foods like onions for therapeutic purposes, especially if you're on diabetes or blood pressure medications. This video is for informational purposes only and does not replace medical advice. Onions' impact on digestion and gut health overnight. Your gut doesn't sleep when you do. In fact, some of its most critical work happens while you're resting. And that's where onions step in again. Not just as flavor, but as fuel for your microbiome. Onions are naturally rich in a specific type of fiber called inulin, a prebiotic. Unlike probiotics, which are live bacteria, prebiotics are the food that healthy gut bacteria need to grow and thrive. This means when you eat an onion in the evening, you're feeding the beneficial bacteria that do their work overnight. These microbes help with digestion, immune support, and even the production of mood-regulating chemicals like serotonin. For seniors, gut health is especially important. Aging tends to reduce the diversity of gut bacteria, making digestion more sensitive and sometimes irregular. Inulin-rich foods like onions can help restore balance, reduce bloating, and promote more regular bowel movements, often noticeable by the next morning. Additionally, onions contain fructooligosaccharides, FOS, another form of prebiotic that helps inhibit harmful bacteria like Clostridium and Salmonella, while boosting bifidobacteria, a type of bacteria often associated with strong digestion and immunity. You may also notice less heartburn or acid reflux over time. That's because a healthier gut environment leads to smoother digestion, even while you're asleep. But here's an important note. Some seniors with IBS or FODMAP sensitivity may find raw onions difficult to tolerate. In such cases, gently cooking the onion helps reduce the FODMAP load while still offering digestive benefits. This video is for educational purposes only. Always consult your doctor before adding foods like onions for gut health, especially if you suffer from IBS, reflux, or are following a FODMAP-restricted diet. How onions support joint health and reduce inflammation. One of the most common complaints I hear from seniors is about joint pain and stiffness, particularly in the knees, hips, and lower back. And while many turn to painkillers or supplements, few realize that everyday foods, like onions, can offer real anti-inflammatory support when eaten consistently. Onions are rich in quercetin, a natural flavonoid found mostly in the outer layers of red and yellow onions. This compound has been extensively studied for its ability to inhibit inflammatory markers in the body, particularly the kind linked with arthritis and age-related joint degeneration. In simpler terms, quercetin acts like a shield, calming the body's overactive immune responses that cause swelling and stiffness in joints. In addition, onions contain sulfur compounds such as cysteine sulfoxides, which are crucial building blocks for collagen production and connective tissue repair. These sulfur compounds help maintain the elasticity and strength of joint cartilage, something that naturally weakens with age. There's also a link between onion consumption and reduced oxidative stress, another major contributor to chronic pain. By lowering oxidative damage in the joints, onions can help preserve joint mobility and reduce those painful, inflamed mornings that many seniors face. A study published in the Journal of Food Science showed that regular intake of flavonoid-rich foods like onions reduced markers of cartilage breakdown in people with early osteoarthritis. The key, however, is consistency, and the evening is an ideal time to load your body with these compounds for overnight repair. If your joints feel stiff when you wake up, try adding onion to your dinner, or better yet, in a light soup or sauté before bed. Over time, it may help ease inflammation without needing additional pills. Detox support. What onions do while you sleep. While you sleep, your body goes into repair and detox mode, cleaning out cellular waste, neutralizing toxins, and preparing your organs for another day. And guess what? Onions can be powerful allies in this process. Onions are among the few common foods that naturally support liver detoxification. Why is this important for seniors? As we age, our liver's efficiency can decline. Slower detox function may lead to fatigue, brain fog, and a weakened immune system. Onions help by supplying the body with two essential compounds, glutathione precursors and organosulfur compounds. Let's break that down. Onions are rich in sulfur-containing amino acids like cysteine, which help the liver make glutathione, the body's master antioxidant. Glutathione plays a critical role in filtering harmful substances from the blood and supporting the body's internal cleansing system. Moreover, onions' natural antibacterial and antiviral properties, especially from its sulfur compounds, support your gut and immune system as well. This means fewer toxins pass into your bloodstream, and the overall burden on your liver is reduced. Some natural health practitioners even recommend placing sliced onions in your socks or under your bed to draw out toxins. But let's be clear, there is no scientific basis for that method. The real benefits come from eating the onion, not stepping on it. So if you're looking to help your body detox naturally during sleep, a small serving of onion with dinner, or even as part of a warm broth before bed, may gently support that nighttime cleansing process. And again, this doesn't mean you're replacing medications or detox treatments. It's simply a dietary support tool with real biological benefits. Onions and their role in heart health for seniors. Heart disease remains the #1 cause of death among seniors. But here's a surprising fact. Eating just one onion a day, especially in the evening, may support your heart health in multiple ways. Let's start with blood pressure. Onions are rich in potassium, a mineral that naturally helps relax blood vessel walls, reducing tension and promoting smoother blood flow. But that's just the beginning. The compound quercetin, which we've mentioned earlier, also helps lower LDL cholesterol, the kind often referred to as bad cholesterol. It works by reducing inflammation in blood vessels and preventing oxidative damage that can harden arteries. According to a study published in the British Journal of Nutrition, participants who consumed onion extract daily showed reduced systolic blood pressure and improved vascular function. These are real, measurable changes that could lower the risk of stroke and heart attack, especially in seniors. Another powerful compound in onions is thiosulfonate, which acts as a natural blood thinner. It's similar in function to aspirin, reducing the clumping of platelets that can form dangerous clots. This can be helpful for seniors at risk of atherosclerosis, though caution is needed if you're already on blood-thinning medication. Here's a simple routine. Eating onion with dinner, raw, lightly cooked, or in a warm soup, can deliver these cardiovascular benefits as your body rests and repairs overnight. Your blood vessels relax, inflammation reduces, and your heart isn't under as much pressure. It's not a miracle, but it's a powerful and natural addition to your heart-friendly lifestyle. Onion's sleep-boosting and anxiety-calming compounds doesn't come easily for many seniors. Whether it's nighttime anxiety, restless legs, or waking up too early, quality sleep often becomes elusive with age. But did you know that something as ordinary as an onion might quietly help you drift into deeper rest? Let's explore why. Onions naturally contain small but effective amounts of L-tryptophan, an amino acid involved in the production of serotonin and melatonin, two crucial hormones for regulating mood and sleep-wake cycles. While it's not a sleeping pill, onion can gently encourage the body's natural ability to calm down. In addition, onions release compounds like gamma-aminobutyric acid, GABA, precursors. GABA is the brain's primary calming neurotransmitter. When active, it lowers brain activity, reduces mental chatter, and makes it easier to relax, both physically and mentally. Interestingly, onion's mild sedative effect was even recognized in traditional Persian and Ayurvedic medicine. People often ate lightly cooked onion with warm milk or broth before bed to ease tension and support natural rest. For seniors dealing with nighttime anxiety, eating onion at dinner, especially paired with magnesium-rich foods like spinach or whole grains, can help trigger the body's parasympathetic system, your rest and digest mode. It's gentle, non-addictive, and completely natural. However, if you notice the opposite, that onion keeps you up or causes reflux, it may be best to consume it earlier in the evening or in cooked form. Everyone's system is different, and personalization matters. How to eat onion before bed: raw, cooked, infused water. By now, you're probably wondering, what's the best way to eat onion before bed to actually see these benefits? The truth is, it depends on your body's tolerance and health goals. Let's break it down simply. 1. Raw onion, maximum potency but strongest impact. Raw onion contains the highest levels of quercetin, sulfur compounds, and prebiotics. If your digestion can handle it, eating just a few thin slices of raw red or yellow onion with dinner or about an hour before bed can offer powerful benefits, especially for blood sugar, heart health, and detox support. However, raw onion can be harsh on sensitive stomachs. It may cause gas, bloating, or acid reflux in some seniors, especially when eaten late at night. 2. Lightly cooked onion, gentler, still powerful. Sautéing onion in a small amount of olive oil for 3 to 5 minutes helps preserve most of the flavonoids while making it gentler on your digestive tract. This method is ideal for seniors with acid reflux, IBS, or who are prone to heartburn. Plus, pairing onion with olive oil enhances the absorption of fat-soluble antioxidants, making the benefits more bioavailable. Add it to a light soup, dinner plate, or enjoy it as a small evening snack with whole grain toast. 3. Onion-infused warm water or broth, soothing and digestive. For those who can't tolerate onion pieces at all, consider this. Chop half an onion, steep it in hot water for 10 minutes, strain it, and sip the warm liquid. This extract still delivers some antioxidants and prebiotics, especially helpful for gut health and hydration before sleep. You can even add a pinch of turmeric or lemon for added flavor and liver support. Important tip: avoid pairing onion with heavy, fatty foods late at night. That can delay digestion and disrupt sleep. Instead, pair onion with something light, calming, and hydrating. Who should avoid eating onions at night? While onions can be a powerful ally for many seniors, they're not ideal for everyone, especially when consumed before bed. Let's talk honestly about the risks, interactions, and specific conditions where onion intake at night should be limited or avoided. 1. People with acid reflux or GERD. Onions, particularly raw ones, can weaken the lower esophageal sphincter, making it easier for stomach acid to flow back up. This can lead to heartburn, sour taste, coughing, and even interrupted sleep. If you're already managing GERD, especially with medications like proton pump inhibitors, PPIs, avoid eating raw onions close to bedtime. If tolerated, lightly cooked onions earlier in the evening may be safer. 2. Those with irritable bowel syndrome, IBS, or FODMAP sensitivities. Onions contain FODMAPs, a class of fermentable carbohydrates that can cause gas, bloating, cramping, and loose stools in people with IBS or sensitive digestion. These symptoms may worsen at night and impact sleep. Cooking onions helps break down some of the FODMAP content, but for some, even cooked onion may cause discomfort. Monitor your reaction carefully. 3. Seniors on blood thinners or anticoagulants. Onions contain natural blood-thinning compounds, especially thiosulfonates and quercetin. If you're taking warfarin, aspirin, clopidogrel, or similar medications, eating large quantities of onion may increase your risk of bruising or bleeding. While a small serving at night may be fine, it's essential to talk with your doctor before making it a habit. 4. Diabetics on medication. Although onion can help stabilize blood sugar, combining it with diabetes medications like metformin, insulin, or sulfonylureas could lead to hypoglycemia, especially if taken late in the evening without proper food balance. Always monitor your blood sugar and inform your healthcare provider if you plan to add onion regularly to your night routine. 5. Allergic reactions, rare but possible. Some individuals may have a sensitivity or allergy to onion compounds, especially when raw. Reactions may include skin rashes, itching, watery eyes, or even breathing difficulty. If you notice any symptoms after consuming onion, discontinue use and seek medical advice. So what happens when a senior eats one onion before bed? You're not just eating a vegetable, you're giving your body a natural tool that may support stable blood sugar through the night, nourish your gut microbiome, ease joint pain and inflammation, assist your liver's detox processes, strengthen your heart health, and even help promote better sleep and calmer nerves. But here's the most important message. No single food, not even onion, is a magic solution. It's about building small, consistent habits that support your overall health. Eating onion at night might seem simple, but over time it may quietly assist your body in the background, helping you sleep more soundly, digest more efficiently, and move with greater ease. However, every body is different. What works beautifully for one senior may cause discomfort in another. And that's where your doctor comes in. I always tell my patients, food is powerful medicine, but only when it's used wisely, personally, and respectfully. So start small, test gently, cook it if needed, and always listen to your body. Thank you for joining me today. I'm Dr. Boone, and I hope this helps you take one more natural step towards stronger, calmer, and healthier aging. Stay well and stay informed.